A new drug is being billed as a potential game changer in the fight against obesity. Two studies have now found that Mounjaro, a medication used to treat type 2 diabetes, is also effective in helping patients with weight loss. It's not yet approved to treat obesity, but drug maker Eli Lilly is pushing for FDA approval for that as early as the end of the year. NBC's Aaron McLaughlin spoke with one study participant who said this drug changed her life.
For almost a year, Jennifer Huber has been taking the drug once a week to treat her type 2 diabetes.
I get emotional. I'm down about 60 pounds, which that was not part of the plan.
Did this drug change your life?
It's changed my life. Even though I'm a smaller person now, I feel that I'm more visible out in society.
Lots to discuss with NBC medical contributor Dr. Vin Gupta. Dr. Eli Lilly claims their studies showed that participants lost nearly 16% of their weight over an 18-month trial. I think a lot of people are looking at this and maybe thinking, is this too good to be true?
Well, Anna, moments like this, thank you for having me, highlighting this important topic. This is a transformational moment for public health and medicine more broadly. Rarely, Anna, do we have these moments where we can change the course of a chronic epidemic like the obesity epidemic. 40% of American adults qualify as being obese based on just current guidelines. So Mounjaro is a big deal. This is going to be a second, hopefully, tool to combat obesity. We've seen rates amongst those that are just overweight without being diabetic at the same time lose almost 20% of their starting weight, on average 52 pounds. That's better than the results with Wegovy. So this is a really transformational moment for public health.
But what do you tell people who think, well, it sounds good, but isn't this just a quick fix for a long-term problem?
That's a great point. So there's a lot of key gaps here. Number one, how long do you need to take these medications? We don't know that yet. It's once weekly in the majority of cases for these types of medications. It's an injection. We don't know, Anna, if you have to take it lifelong, or do you just shed the weight that you want to shed, and then does it stay off even if you stop the medication? We're still trying to learn more here. What we've seen, though, is anecdotal reports that once people lose the weight that they'd like to lose, they're able to keep it off because lifestyle changes really start to kick in. You look good, you feel good. There's some residual impact from just being on that medication. And that progress sustains itself, but we have to see whether or not this continues over time. Side effects are actually pretty benign, just nausea, vomiting, diarrhea in a very small group of patients here, largely very well tolerated. That's a good sign too.
How does it work? Is it different than some of the other drugs we've talked about recently, like Ozempic?
Very similar to that. It convinces your body that you're full, even if you haven't eaten a full meal. It basically acts it causes your body and your brain centers that control your appetite to say, you know what, you're full. And so in afterwards, you don't eat as much when you're due for a meal. So you're just taking in less calories. Your body thinks it's full, and that's how you're able to shed so much weight.
Worldwide, obesity has nearly tripled since 1975. You talked about what a problem this is. Here in the States, it's estimated to account for more than 20% of all annual healthcare expenditures. Given that, should drugs like this have more access and more insurance coverage as they hit the market? We only have about 30 seconds, just so you know.
I'll quickly say that there's a gap between opportunity and access, exactly as you point out. Right now, most insurance companies are not covering for this. This is all out of pocket for the vast majority of people that would qualify. If you're a type 2 diabetic, have a conversation with your provider about this medication. But right now, there is a big gap between access, affordability, and those who can benefit from this drug.
Thank you so much, Dr. Vin Gupta, with all that great information. It is really interesting. Hope it's the breakthrough that you are expecting it may be. Thanks again.